Great. Welcome once again, everybody, to the Advocates Roundtable. This is being recorded. So the recording of this meeting will be posted on the Commission's webpage shortly after the meeting. And this is a special meeting of the Universal Healthcare Commission. It's our first ever Advocates Roundtable. So I will turn it over to Chair Vicki Lowe to call the meeting to order.
Thank you, Mary. Welcome, members and advocates, to this special meeting of the Universal Healthcare Commission. It is 3:02, and I call this special meeting to order. I'm going to start with a land acknowledgement. I would like to begin by acknowledging that as we gather today, we are on the ancestral homes of Indigenous people everywhere. Indigenous people, despite being removed from the lands where they lived, hunted, gathered, practiced ceremony, and cared for their community members, and still care for the land. Indigenous people and tribes, whether officially recognized by the United States government or not, continue to care for these lands and their community members. As health professionals, it is important that we also acknowledge the impacts of the removal from traditional lands, of children stolen to boarding schools, of the oppression of culture and traditional ways of life on the health of Indigenous people throughout the country and in Washington State. As we work to improve health in Washington State, it is imperative that we address the inequities of the past by understanding their impacts on the present. I invite each of you to learn about and understand the true history of the Indigenous lands where you reside on. Thank you. I want to give a warm welcome to everybody for being here. And we have two elected officials with us today, which is really exciting. So we have Representative Parsley, who is our official legislative advisor. And then we have Senator Cleveland, and I'll let you guys I'll give you each a very short 90 seconds or less. Do we have a red light?
or a hook to pull us off the floor. Mine will be really short. I'm very, very happy to be here. I have spent in my entire career in one form or another related to healthcare, and I was raised by healthcare professionals, both RNs as well as MDs. I have a vested interest in this because I'm seeing my own profession, veterinary medicine, go through the exact same things, but about 30 years delayed. But you can map out where we're going by what's happened in the human world. So I'm hoping to be able to come along. I have a lot to learn, I admit that, but I'm also here to add a voice.
Thank you, Madam Chair. I'm Senator Annette Cleveland. I represent the 49th Legislative District, which is in Southwest Washington, encompasses Vancouver and parts of Clark County. I also serve as chair of the Senate Health and Long-Term Care Committee and have done so since 2018. And in fact, very pleased to have been chair and helped marshal the legislation through that created this commission and gave the direction for the work that you've been hard at for many, many months now. I am pleased to be hopefully joining the commission pending an appointment by the Senate leadership shortly. This is such important work. Certainly, I bring to this work not only my 4-decade career having worked in policy as congressional staff, but also over 2 decades working in healthcare, both hospital-based healthcare and then children's behavioral health as well. So just really pleased to be joining you today and really looking forward to the information that's going to be shared with us. So thank you for having me.
Thank you both for being here. I would also like to acknowledge in the room, we have Commissioners Dave Ensminger from the Healthcare Authority.
Hi, Chair Lowe. Dave Eisminger. I'm here on behalf of the Healthcare Authority. I oversee at HCA the commercial work, insurance lines for PEB and SEB, as well as the procurements for Cascade Select for the public option.
Thank you. And Joan?
Hi, everybody. My name is Joan Altman. I direct our coverage expansion and strategies portfolio at the Washington Health Benefit Exchange, which runs the platform Washington Health Plan Finder that's currently serving 2 million out of our 7 million Washingtonians.
And I didn't introduce myself, which sorry. So I squatchy Vicky Lowe since Nastatithlam New Sklayam since not Nuxlak. My name's Vicky Lowe. I'm Jamestown Sklallam, Bella Coola First Nations. I'm the executive director for the American Indian Health Commission, which means I work on behalf of the tribes and urban Indian health programs, Indian healthcare providers in Washington State, and get the pleasure of being the chair of this commission. And I'm going to ask Mary to help me with, or Allie to help us with the commissioners online. I know some couldn't be here in person, but
Badisha is online. Badisha Mandal.
Hi, I'm Vidisha Mandal. I'm a professor and a health economist in Washington State University.
Thank you. And Representative Joe Schmick, our third legislator here today.
Joe Schmick, 9th District.
Thank you. Mohammed.
Thank you. Mohammed Shidani, with the Somali Health Board as a deputy director, been in the commission and also for my second term in the commission, and also I've been part of the work group. Pleased to be here with you all today and along with my fellow advocates.
Thank you. We also have members of the Finance Technical Advisory Committee, generally called FTAC. FTAC advises the Universal Healthcare Commission. We have one FTAC member in the room. We have Roger Gantz back there. Hi, Roger. And some folks online, Bob Murray. Got away from Bob. Matthew Morrissey.
Good afternoon. My name is Matthew Morrissey, and I'm representing the Department of Revenue.
Christine Eibner.
Hi, I'm Christine Eibner. I'm an economist at Rand Corporation.
Pam McEwen. Oh, you're on mute, Pam.
Yeah. Okay, now that should be better. If everyone can hear me, I'm Pam McEwen, and I am a member of FTAC and most recently CEO of the Health Benefit Exchange.
Eddie Rouser.
Hi, I'm Eddie Rouser. I work for the healthcare forecast group, and I'm on the FTAC committee.
Thank you all. And now I'm going to pause. Did I miss any members of the commission or FTAC?
Roger didn't get to say.
Good afternoon, Roger.
all right. Thank you, Mary. And then we'll have our advocates introduce themselves as we start the roundtable, and they can introduce their organization so we don't have to do it twice. All right, so today we are here to hear from healthcare advocates. The commission is grateful for input and public comments these advocates and members and their organizations have provided to both the commission and the FTAC over our time. As a reminder, the commission welcomes and encourages public comments. During our regular meetings, public comments can be provided orally during regular meetings or in written format at any time to the commission's inbox, which is HCA Universal HCC at hca.wa.gov. And commission members do review and consider these public comments as we receive them. By design, according to the Open Public Meetings Act, commission members generally will not respond to public comments during regular meetings. And this can be, this is always awkward for me. I'm also on city council, and whenever we have public comment, I was raised to like respond, and open public meetings just aren't built that way. So if it gives the impression that we're not listening or we're not taking what you are saying under consideration, it's just the way that the meetings are built. But we are hosting this meeting today because we have heard from you that, you want to really have more conversation, and so we want to hear from you. We have some questions for you, and you have some questions for us. And this is the first time we've ever hosted something like this, so I'm really excited for this opportunity and appreciate all of you coming in person and those of us who are joining us online. As you know, the state has a limited budget forecast, and the legislature has not yet funded a transition to healthcare. And I think that's, been painful for a lot of us. And the work, as we try and fit it into the budget, maybe does not meet the needs of what people are hoping for, but it's been the focus of the commission to keep moving the work forward incrementally so we can get there. I know when I was asked to chair the commission, that was the discussion that we had, is just, how can we get this, keep the work moving? And so we have been working on that, following the work plan of the Universal Health Commission or Healthcare Work Group that I think a lot of you were on with, and I was on that work group too. But partnering with you guys is really important, and we really feel like that can help us move the work forward more quickly and in a way that gets us to the goal that we want. I just want to remind everyone that, we take action as a commission by voting, but you're going to hear from us in our individual capacities as commissioners. And so, keep that in mind as we have these conversations. So I'm going to turn it back over to Mary to give an overview of today's meeting.
Thanks, Vicki. I realized I did not introduce myself either. I am Mary Franzen. My official title is Coverage Strategies Manager. I work for the Healthcare Authority, and I lead the team that staffs the Universal Healthcare Commission. The other person who works on that is over there to my right, Allie Power, who is our health policy analyst. So again, thank you. We have 4 very active advocacy organizations joining our roundtable today. We have Healthcare for All Washington, Healthcare is a Human Right, Northwest Health Law Advocates, and Whole Washington. No, and as Vicki said in a few moments, did I get it wrong?
Along with Washington Can.
Washington Can. Okay. I wasn't sure what was Washington Can and what was this is a good thing we can hear about today, the Coalition of Healthcare as a Human Right. So good. Thank you. So before we begin, as Vicki said, we have public comments, and there's sometimes a perception that, we're not listening or not taking action. So I wanted to sort of address a few things that we know are ongoing concerns and things that we have tried to take on. One is things have come up recently in public comment about the order in which the commission addresses certain topics. We have this work plan and we're kind of marching through it. And there was some comment recently asking to consider governance sooner, maybe change around the order of things. And, we're well aware that these things can be addressed in many different orders. We have our counterparts in Oregon who are going about things in a completely different order. So what we learned, the commission did have this discussion, should we move governance to a different part? Should we change the order of our topics? And I think we learned a couple really important things. One is the commission is very focused on moving through the existing plan. And so there's, I don't want to say reluctance, but there is, what's the word I want? They would take great care to move around the order for anything that would make things slow down a bit. And I think the other thing that came out of this conversation is that just because something is near the end of the list, that doesn't mean people think it's unimportant. It just means they think this is the proper order to address things. In fact, that came out very strongly in our conversation about governance, when it stayed in the same place in the work plan. But then the follow-up discussion was about building public trust and how important it is to do this with great care, and how much time needs to go into this. So even though something is farther down on the list, it's not forgotten, and it will get a lot of attention, and people do know how important it is. The other question we get sometimes is about the pace of the work. We've all been at this a long time. So in the past year, what we have tried to do, and I will give my thanks to the commission members and the FTAC members up front, what we've tried to do is kind of spin off small pieces of work and create some ad hoc groups who can address things in more detail, come up with more detailed recommendations, and then bring it back to FTAC or bring it back to the commission. And that has worked well. And it also means that people who are doing this in a volunteer capacity are giving us even more of their volunteer time. So thank you for that. So I'm going to get back now to today's roundtable. We want to continue the conversations in a less formal setting. I think, as Vicki said, the goal is to gather input that can help the commission address upcoming topics. Again, thank you to the advocacy groups who help us put this together. Ross Valori is going to be our moderator. He is the board and commissions director. You're covered now in case you forget to introduce yourself, Ross. You're board and commissions director. And we also invite commission and FTAC members to ask follow-up questions as we go along. I hope this is, more of dialogue with the commission members. And also at the end, commission members, you can share your reflections, or if you care to, you can respond to questions that the advocates have shared in advance. So I think we need the next slide where I get to be the person who reads the rules, highlights some meeting expectations, respect each other in action and in speech, listen with an open mind, consider your thoughts before speaking, honesty in all communications, contribute from your lived experience, clarify to avoid assumptions, plain speak as much as possible, and use specific or brief examples for clarity. The note at the bottom is if a participant violates these meeting expectations, they'll be reminded of the expectations for today's meeting. And so I hope that helps us foster a productive and positive environment. And now I'm going to turn it over to Ross, who's moderating our conversation.
Thank you, Mary. Again, Ross Valori, Board and Commissions Director here at HCA. Very excited about this opportunity to bring everyone together to have this discussion. Just want to reiterate the points that Mary made, that this is our first opportunity to have this type of discussion and an innovative approach, but we recognize, and again, to try and have that conversation and dialogue between members, FTAC members, and the public, but recognizing that the board and commission structure isn't necessarily very conducive to that. And in saying that, and today's our first opportunity at this, acknowledging that we're probably not going to get all the way there with today's meeting. We're very hopeful that this will be a great opportunity for dialogue and discussion, but know that, we are going to review this meeting and look for opportunities to improve. So just appreciate you going on this journey with us, appreciate your patience, and we're certainly open to feedback and ways to improve this. So with that, I will bring us to our first question today. One more slide, please, Audrey. Thank you. The first question that we are going to ask our advocates to respond to is, let's see here. Do we have the questions on here? Oh, okay. I'll just read the question just to make sure everyone's on the same page. Please take 5 minutes to introduce your organization. We would like you to tell us about your vision for universal healthcare in Washington and your organization's efforts in working towards that vision. Please also tell us how you complement other organizations' efforts. And maybe we will start with Ronnie Schur and Marcia Stedman with Healthcare for All Washington.
So my name is Ronnie Schur. I'm the president of Healthcare for All Washington and a retired pharmacist. I've spent my career in public health, substance use disorders, and behavioral health, and worked mostly for King County Public Health, including 10 years in King County Jail as a pharmacist. And I would like to introduce Marcia, who will be much more humble in her introduction, but it's just as important in this discussion. Advocates are just as important.
Thank you, Ronnie. So my name is Marcia Stedman, and my career has been in public relations and customer relations. I love solving problems, and this is a big one. I have been a member of the board of directors for Healthcare for All Washington since about 2014, and I'm still involved in the work. I'm pleased to be here. Thank you for hosting this, and Vicki, thank you for having us here today. So I will start by telling a little bit about our organization. So Healthcare for All Washington is Washington's oldest grassroots organization dedicated to universal healthcare. The board of directors includes healthcare professionals and longtime advocates focused on equitable and accessible healthcare for all Washington residents. We began in 1994 when we were known as the Washington Single Payer Action Network. Several other states also formed SPAN organizations to advocate for state-based single-payer healthcare. Then in 1997 through 2002, we changed our name to Healthcare Now and transitioned to Healthcare 2000 when we mounted our I-725 initiative campaign for universal publicly funded healthcare. This did not gather enough signatures to qualify for the ballot. our vision is a comprehensive, affordable, sustainable, single-payer healthcare system for all Washington residents that is publicly financed and publicly and privately delivered. Ronnie?
So Healthcare for All Washington followed with a bill called the Washington Health Security Trust, which we introduced every 2 years, every biennium from 2003 to 2018. And we had hearings and discussions and learned a lot from the legislators and the healthcare agency staff as we moved through that process. Several of our healthcare champions are here today. So thanks for helping guide us through that. And that led us to a transition to move into supporting a pathway bill, funding bill, and the Universal Healthcare Commission. So we have spent the following years supporting the commission, helping to move it along, attending, making public comments, building relationships with the members of the commission, the members of state agencies, and with legislators who continue to move the action forward. So we transitioned from a bill into this supporting this commission.
Okay. So I'm going to talk about what we do and to collaborate with other organizations. So in 2013, we began by joining with other Washington state advocacy organizations as a founding member of Healthcare as a Human Right. This is a coalition that we'll hear about later, and we've participated in public forums, rallies, and presentations over the years. Healthcare for All Washington members serve on the Healthcare as a Human Rights Steering and Policy Committees, and its HUCS committee that closely follows the commission and works to hold it accountable to its legislative mandate to make recommendations for a universal healthcare system with a unified financing system, including but not limited to single-payer healthcare, but also to recommend transitional solutions that improve healthcare access and affordability in Washington now and will ease the transition to the future Universal Healthcare Commission. In 2017, we shared our Washington Health Security Trust language with Whole Washington and urged them to use it as the framework for their plan, which they did. We were happy to collaborate with them on that language. And since 2018, we have worked with other advocacy organizations and legislators to secure funding for studies, work groups, commissions, and boards. We work with allied organizations to share information and build a unified front, publishing recaps of each Universal Healthcare Commission and FTAC meeting in our monthly member e-bulletins. Our members also serve on the board of Puget Sound Advocates for Retirement Action, PASARA, the Healthcare Cost Board, and the Prescription Drug Affordability Board. And I want to mention about the national organization, One Payer States, which is a group of states who have state-based single-payer legislation or initiatives. They are now numbering over 20 states in this organization. And so lots of collaboration going on from our point of view. Thank you.
5 minutes? Was that 5 minutes?
I was not running the timer, but I think that was close. And I really appreciate it too. I can tell how prepared you are in the back and forth. You're a very dynamic duo. Thank you, Ronnie and Marcia. Okay. I will next see if Nathan and John from Washington Community Action Network would like to introduce themselves and give us a little background in their organization.
Thank you, Ross. I'm going to do a couple, we're going to do a couple intros. First of all, I'm Nathan Rodkey. I am the Healthcare Campaign Director at Washington Community Action Network. But the first little intro I'm going to do is I am also the co-chair of the Healthcare is a Human Right Coalition's steering committee. And in that respect, first of all, I wanted to thank everybody for being here. Whether it's our coalition members or the folks that are turning out. I really appreciate everybody being here and for the acknowledgement, some of the issues that were raised and answering to that a bit and helping us, gather more understanding about that. also the efforts to, add additional groups to advance the work. All of that is really good. And what Ross said, we also see it as an opportunity. We're glad for the opportunity to be here, and we see today as like a big next step. But we all have a lot more steps to do and to take to really get towards this goal of universal health coverage in our state. So, and in our country. So now for the elevator speech, like we're a community labor coalition of over 40 sponsoring members, including our presenters today. And we have many more allied member organizations. Like I was kind of saying there, our goal is to achieve universal public health care on a state and federal levels. We have for our coalition, we have an organizing committee, a policy committee, a communications committee, and a committee known as HUCS, which regularly engages with the commission to help it achieve its legislative mandate. Each of those committees has co-chairs. So this is a large coalition working at it at a lot of different angles. And on that, I am going to pass it to John to begin to introduce Washington Can.
Hello, everyone. My name is John Godfrey. I'm the program manager for Washington Community Action Network. We're one of the constituent organizations of Healthcare as a Human Right. We started out way back in the 1970s as the Tacoma Light Brigade, gone through several iterations since then, and we work on more issues than just healthcare, but that's the capacity. I'm here today as co-chair of the organizing committee of Healthcare is a Human Right. And our vision at Washington Can is a not-for-profit plan for everyone in the state with a structure built around health benefits for people in all corners, regardless of what community they come from, whether it's immigrants, whether it's people who are incarcerated. We believe that healthcare is a human right, as my friends say, healthcare for all Washington, everybody in, nobody out. So then our ultimate goal is a national, as Nathan said, is a national single payer plan, like improved and expanded Medicare for all would be the North Star. But we believe that given what's going on at the federal level, that the state level path is the way that we can most effectively move forward and show the rest of the country the way. And I'll turn it back over to Nathan to talk a little bit more about our efforts.
All right. So Washington Can, the thing that makes us stand out in our organizing community is that we have a full-time field and phone canvas, along with an organizing department that actively fosters community feedback and engagement. We hear about the impacts of inaccessible and unaffordable healthcare every day, among other issues. We also work on housing and mass liberation. We work to counter hospital mergers and other corporate consolidation efforts because on the healthcare front, we just continue to see market-based solutions failing us. And it's virtually at every turn, especially our members. And that's why we believe healthcare must be a public good. The complementary role that we serve in this coalition is a dedicated grassroots voice that mobilizes and educates the public. Many of our members have made public comment at these meetings. Our work is particularly focused on building a broad coalition that includes a powerful labor contingent. There was overwhelming support for a single payer resolution that was adopted at the Washington State Labor Council Convention on July 24th, which calls on state legislators to introduce policies consistent with single payer, which is a testament to the critical need for the active involvement of labor. We're working closely with our labor partners to ensure these principles are at the forefront of the conversation. And our organization does work closely with labor. We have members of labor on our board. And I just want to make sure we were like acknowledging that element in the introduction. So that's kind of what that's in there. So we're really excited about that progress. And on that, I'm going to pass it to Andre. Well, yeah.
Thank you.
Yeah. Sorry.
No,
I didn't know where we're going. Sorry.
And the only thing just to, thank you for that introduction and just wanting to make sure that folks are able to hear us that are participating remotely. If you're having any issues, please just note that in the chat and we will make sure these microphones should be picking up. So just let us know. And I will transition here to Andre and Annie for Whole Washington.
And I was going to actually have Annie introduce herself first.
Perfect. Perfect.
Hi, everyone. Can you hear me okay?
Yes.
Awesome. Okay. Hi, my name is Annie Fitzgerald, and I have been a lifelong disability and healthcare advocate. And I recently started organizing with Home Washington almost a year ago now. I've been organizing and fighting for a Medicare for all system for several years. I serve Whole Washington on the advisory board as Director of Disability Justice and Accessibility. And I do my best to make sure that we are representing the disability and chronic illness community well and making Whole Washington as accessible as possible. Whole Washington is a great grassroots organization that started back in 2017, I believe. And we are a healthcare action organization, and we have created the Washington Health Trust, and which we believe is the best route to fund and provide for universal healthcare within the state of Washington. And with that, I'm going to throw it to Andre.
Thank you, Annie. Hello, everyone. My name is Andre Stackhouse. I'm a lifelong Washingtonian and the executive director of Whole Washington. My academic background is in information science, and I worked in the Washington state tech industry, both in the nonprofit sector at the education company Code.org, and then at a small Redmond startup called Microsoft. I've gotten swept into healthcare advocacy, volunteering with Whole Washington, originally just gathering signatures on an ill-fated ballot initiative campaign, and then campaign director of the next one, and then executive director since then. I think that Whole Washington has played a very significant role in the development of the universal healthcare movement of Washington. Very honored to stand on the shoulders of giants, or to stand shoulder to shoulder with giants. So as was mentioned by Healthcare for All Washington, we did develop our policy from the Washington Health Security Trust. We introduced it to the public both as an initiative and as a bill, and we've carried it since 2018 in both capacities. And I think that the way that I often think about what we contribute to this is we build alignment between the public and the legislature, and now the commission, and labor. So our goal is to really have a very wide reach, to bring a lot of people in, and then to go beyond the consensus of values, which I think have been more or less the easy part, and to move us forward on discussions around specifics. And we do that by putting pen to paper and saying it. We're not here to say that this is perfect or that this is the only way to do it, but it at least is now articulated as legislation. And so our legislation, the Washington Health Trust, includes a transition plan. It includes full public financing, and we think is worthy of very thorough analysis as a framework to move the state forward. When asked, what is our vision for universal healthcare? One that exists, that would be fantastic. And so we have been very collaborative with the commission, and Raleigh is our liaison to the commission. He leads a team at Whole Washington. He's here with us today. And we have presented 3 times to the commission and FTAC, where we have gone over the design of the health trust. We've talked about where we came to our conclusions on the financing. And we're very pleased to get a partial analysis published last year or I don't know, they fly by, but since then, the Health Trust has been retooled. And so time marches on and things change. And so we are hoping and believe that the commission is on the same page as us, that we'll have a completed analysis, revised analysis by the end of the year on the latest version of the Washington Health Trust. So we can really start to get answers on what does everyone think about this? Is this a viable pathway forward? And I just want to say that I think that a lot of this consensus has been built and continues to be built. It seems that we only get further down that pathway. But whether you're talking about public polling, whether you're talking about economic analysis, or whether you're talking about legislation that has been passed by the state legislature that my reading is commits the state to single-payer healthcare, it seems that there is a ton of agreement around this. And so, it's wonderful to have Lisa Parsley on the commission, who is the prime sponsor of the Washington Health Trust in the House. And in the last session, we were able to introduce it into both chambers to record co-sponsors, including members of the respective healthcare committees. And so to that end, we really hope that this helps accelerate the work of the commission by building on framework that has been frankly developed since the 1993 Health Services Act and been carried forward by one form or another, from one org to another, into a larger and larger constituency until we're all here today and saying, what is the next step? So thank you.
Thank you so much, Andre and Annie, for that really helpful introduction. And last but not least, I'll hand it over to Emily Bryce with Northwest Health Law Advocates.
Thank you. Thank you, Ronnie. Thank you. Hello, commissioners. Hi, fellow panelists. I apologize first for being late. I had a prior commitment that I was coming from before being asked to join the panel. So thank you for your time. I'm glad to participate in good company today. I'm Emily Bryce from Northwest Health Law Advocates, and we are a public interest law firm that has been around since 1999. Working to expand access to healthcare for all Washington residents. And I was smiling when Andre was talking about the generations of health advocates who have worked towards that goal, and we'll keep at it. We serve on the steering committee of Healthcare as a Human Right Washington, so we're here in partnership with all of our coalition members. And while we share the goals of many of the pieces that we've already talked about today, we approach the work a little bit differently because we come with a legal lens. And that legal lens is rooted in our history as an organization that has deep ties to free legal services organizations for lower income people. That's our roots as an organization, and we maintain those close partnerships today. And through those roots, we are deeply connected to the experiences that people have in public coverage programs today, in Medicaid and Medicare and other public coverage programs. And we've developed a strong sense of the opportunities in public coverage where they can help fill the holes in our safety net and make sure that the most vulnerable in our system have an opportunity for basic coverage and care. And we also, because we have that legal lens, see the challenges that people face when government systems don't work the way that they are supposed to. And that, I think, gives us a dual focus in our advocacy in this space, both to push forward towards universal health care that is guaranteed as a right for all, and then make sure that we're serving as a watchdog to ensure that those rights are actually protected and honored. And I think that's really important to talk about in this space because one of the things that we sometimes hear from consumers and patients is that they want another system, and they also want to make sure that they're going to be protected in that system. So we try to bring that perspective to the table. Given that kind of dual perspective, we also often tend towards a little bit more of an incremental approach because we understand that government systems take time to perfect. We were right there alongside all of you in the transition to the Affordable Care Act that took longer than we expected and is still taking longer. So we understand that there's a long arc of history here, but we do need to be moving forward, and we need to be moving forward aggressively at this moment in particular. in our long-term vision of a universal healthcare system, we can envision healthcare almost as a public utility. And I think it becomes strange to once you think about, well, we have roads and we have public schools and we have all this other infrastructure that honors and protects people's basic rights and ability to live in our society. Why not healthcare that is literally a matter of life or death for people? We arrive at this system, at that kind of vision, because we have seen over the decades of our work that the system that we've selected to date is growing increasingly corporatized. It is not delivering the care that we expect it to deliver. We are not seeing, and the commission knows all this, we're not seeing the progress on access, affordability, or outcomes that we should see for the dollars that we're investing in our healthcare system. And unfortunately, because the system is rooted now in corporate entities and profit, there are fewer and fewer ways to hold entities accountable for their behavior. We can't vote United Healthcare out of office. We can't do anything when a national hospital chain chooses to close a hospital in our community. There's no way to hold them accountable. And so that leads us to a growing sense that we need to take the reins back in our healthcare system and have a conversation about what we want to have in Washington State. Thanks for the opportunity to be here.
Thank you so much, Emily, and to all the advocates for those introductions. Before going to our next question, just want to see if any commission members or FTAC members had any questions they'd like to follow up on to those introductions. If not, happy to take those as we roll into a little bit more substantive. Oh yeah, go ahead, Mary.
Mary. Hi, Mary Franzen, not a commission or FTAC member, but I do have a follow-up question. Very intrigued by a description you just offered us, Emily, about thinking about public utility model and healthcare as a public utility. I think it's fair to say that that's really not how we think about healthcare in this country, but an interesting model. And I guess my question is, how do you get people even to begin to go down that path or even begin to think of it that way?
Well, I invite other people's thoughts on this, but I think one important piece is to think about meeting Washington residents and the American people where they are, which is we don't necessarily have to jump to a model that is radically different in every respect to our current system. We see, for example, that there are private entities that partner with public utilities all the time, right? The roads are built with the assistance of private entities. We see private entities operating in electricity and water space, right? But the key components are that there's a plan and an infrastructure that is developed with public oversight, accountability, and central planning. And that allows us to have a different kind of a conversation than we have in healthcare today. So when I say public utility, that doesn't necessarily mean that all private entities can no longer participate. I think there's a role for private entities to play, but just that there can be a different kind of a dialogue about who is driving that system.
And there are lessons that we should learn from the rest of the world, or lessons to be learned. Certainly, universal coverage can be accomplished in a number of different ways. And the role model of a public utility is one of those basic models that we should be learning from countries that have successfully or have run into barriers for that. And we have a system that's based on a nonprofit system in our healthcare industry, but there is a way to control that. We have an insurance commissioner who monitors insurance companies and can actually be putting and other entities, an attorney general who can find that there are organizations that are overdoing that nonprofit motive. And I wonder, from my Jewish heritage, there is a song we sing on Passover called Dayenu, which means, isn't there enough? Wasn't it enough that certain things happened that, and can't insurance companies say, can we say to insurance companies, isn't that enough? To hospitals, to large entrepreneurs? Dayenu.
Thank you. Anyone else wanting to respond to Mary's question, not wanting to cut off conversation? Yeah, sure. Go ahead, Andre.
Just very briefly, we look at, and I've brought it to the commission many times, the World Health Organization's definition of universal health care. And, I'm not going to get all of the planks right now, but they mention, not a significant portion being publicly funded and a nonprofit model. And to me, I think there are multiple ways to deliver on a universal healthcare system, but the primary characteristics that would be different from the system that we envision and the system we have today would be decommodification, right? So I think that's really the key driver of what we want to see. And so it's the publicly funding the vast majority of it, not necessarily all of it, but that is the common characteristic you see from international models is almost regardless of what system they use, the vast majority of care for that country will be publicly funded. And then there is an elimination of the profit-seeking entities. Now, nobody's perfect, and I think that it finds its way into every system. But I think that you would look at that as sort of the primary design of the system that we have here and the primary difference between what we're aspiring to.
Great points. Thank you so much, Andre. And I see Annie has her hand up. Please go ahead, Annie.
Hi, I just wanted to add that I think we all recognize that like healthcare is something that should be a human right. And as someone who sees a lot of doctors and has a lot of medical appointments, the current system we have is not working. So many people in this country, the leading cause of bankruptcy is medical debt. And so what we want to see is like Andre said, we want to see the deep commodification of our healthcare system so that everyone can have equal access to healthcare, so that they don't have to worry about going into debt, and so that they can make sure that their needs and their family needs are taken care of. And there are multiple ways to do this, as other people have already said, but I think it's really important that we take the profit motive out of it so that more people can have access. Thank you.
And I see Mohammed has his hands up. Please go ahead, Mohammed.
Thank you very much. And I don't know how appropriate this will come across because I am commissioner, but I just wanted to add to the personal story, and I know the pain caused by our health insurance situation here in the state and this country is riddled with the stories of actual people. For example, I'm lucky, but because of my age, I don't have a lot of medical bills and all of that. But I actually, as a hardworking human being, have been working since I was 17, never stopped. I enjoyed that part of my life. I'm not complaining about working, but I pay half my salary for the premium to cover myself and my other 5 family members, my wife and my kids. And I'm not complaining about that, but I still have to deal with when my baby, one of my girls has strains her foot, and I take it to emergency, have to pay a lot of money out of pocket. I have to meet the deductible. And I am struggling as a as a working class, and I can only imagine what's happening to the many Washingtonians who might not be making as much money or who cannot work as hard as I do. So this is from a human, like, take out all the other layers and the complexities and the things that have to be in place and governance and all of that. On a basic level, this system does not work. Actually, it's causing more harm than health to Washingtonians, and that is why this kind of conversations are very urgent. That's why Universal Healthcare Commission, a Universal Healthcare conversation is a lot more urgent. And I hope we figure something out in this state that can also benefit the rest of the country. I just want to add my voice to that. I'll lower my hand now.
Thank you so much, Mohammed, and appreciate all these comments, which I think ground us really well as we kind of head into some of these substantive questions. So Audrey, if you would move us to the second slide. So our next question for the advocates is, the commission plans to take up financing in early 2026. There are many ways to fund a universal system. What funding mechanisms is your organization aware of, and what recommendations do you have in terms of funding universal healthcare? And I will, Audrey, would you click back 1 second? Yes, I just want to follow the same. I'll start with Ronnie and Marcia for responses on that. And happy to kind of just follow that same pattern, and then we can go back to the slide with the questions. Sorry, Audrey.
So we actually talked as a collaboration, as a coalition, that we would have a lead on each of the questions.
Oh, okay.
So if you don't mind,
sure,
we start with Whole Washington's lead.
And so just to clarify, so Andre, you're speaking on behalf of all of the Hux committee, or are you speaking on behalf of?
I think that the coalition would agree with a lot of what I'm saying. There will be a whole Washington element to it, I'm sure, but it's also not intended for me to be the only one who speaks on it, but rather the one who provides the bulk of the answer, with other people providing little slivers.
Okay. So kind of a general response, and if any other advocacy group members have any clarifications, they can provide that.
I think so.
Excellent. Okay. Yeah, please go ahead. Thank you, Andre.
So I think that this is always brought forward as one of the biggest challenges that needs to be solved. And I think that it often is the thing that people want to talk about this, and then right when we get to the funding part, the conversation ends. And so I think it's very important that we actually lead with this, right? And figure out how much are we talking about raising, and what are the ways to do that. I think that the simple answer is that we believe in healthcare that is guaranteed, regardless of ability to pay, regardless of employment status, and that this would be paid for primarily through public financing, ideally progressive taxation, which I know is a challenge in Washington's tax code, but that we would, to the greatest extent possible, eliminate point of service costs. And there's a number of reasons for this, but one of the core driving motivations of this commission and universal healthcare is to create more equitable outcomes. And so by removing the barriers to receiving care, the economic barriers, right, you're able to then give people the ability to seek care that they are currently not able to seek. This is borne out across a number of different studies, but the first thing is that despite all that we pay and the high amount of cost sharing on individuals, it does not increase our access. Somebody was an economist from the Rand Corporation. We often cite a study from the Rand Corporation that finds a 2% increase in cost sharing on the patient results in a 10% reduction in utilization, right? And we know that that's the people who can't afford to pay, right? So it's at the bottom, it's increasing the inequality, the higher the cost sharing on the individual. So Our vision would be one in which there is little to no point of service costs, and that there is very, very little private spending. Compared to where we are today, it would be a huge reduction, and that the vast majority of the funding would come through progressive public financing. Whole Washington does have a specific proposal for this in the Washington Health Trust, and it is designed to effectively get the funding from where we already get it. So we pay twice as much for healthcare as peer nations that have universal healthcare systems and achieve universal coverage. And in most cases, and in the United States, it's a split between employers and workers. Right now, if you get employer-sponsored health insurance, it would be through employer premiums and individual premiums, and we instead move that into an employer assessment. And in the latest version of the Washington Health Trust, it's a graduated assessment between 4.5% of payroll and 10.5%, depending on the size of the company, with up to 2% deductible from the employee's wage. So that split between employer and worker remains. There's a negotiable 2% on the worker. That's something unions can negotiate on, or individuals can negotiate on. The employer can cover it or not. But the structure is the same. It's just allocated towards public health care rather than into private profits.
Thank you, Andre. Is there any additional comments folks have on that? And my apologies. I see you guys gave me all the answers and I still messed it up. So apologies. Nathan. Oh, did you have your?
Yeah. I just want to throw a few things out there, just a few points to make. They kind of connect with Mary's question and also what Andre's talking about. I was struck by something I saw recently. Germany's GDP, the country of Germany, who has much better healthcare outcomes than we do as a first world nation, and they guarantee healthcare for everybody. Their GDP per capita is roughly the same as Mississippi, which is like the poorest state in this country. So when we think about like how we understand how money flows through our economy and how it can deliver healthcare for everybody, like guaranteed for everybody with better outcomes, or with a lot of the stuff Andre's speaking of, I think that's a really good comparison, because when you look at our economy, taking it more to the second question, while it's a challenge in our state to raise progressive revenue, it's also, to me, I want to like lay it out there, it's an exciting opportunity. As much as I find it very distasteful and disgusting that the billionaire class is growing at such a rapid rate when compared to the rest of the country, there's also an opportunity to tax those people at a larger rate as well. And to give some examples, like I know that some of the stuff, I'm not here to hold space for them in any way, shape, or form, not in any way. Now, you look at some of the counter arguments you'll get, like, oh, some of them are going to like move. Okay, a few of them will. Not too many of them will, though. Most of them are going to stay. And us being willful and stepping up to the opportunity to create a more equitable society by taxing wealth, when if you look at the last 45 years in this country, again, the wealth gap it's an abomination. And so I think it's really important that in this moment, especially when we look around this country, that we hold our heads high and we're really unafraid to like speak to that injustice, and in conjunction with the injustice of people not having health coverage right now and losing it. And we are looking at a timeline of 8 consecutive months where people are just going to be getting knocked off again and again for different reasons for this big ugly bill. So I would say let's rise to the occasion for the opportunity to tax a lot of the billionaires in our state.
Thank you, Nathan. Emily?
We have time for me to add one other piece?
Of course.
Thank you.
Please go ahead.
So I'll try to be brief here. First, appreciate all the comments that have already been made. I'll just add that we're further along in this venture than we might think. And when I look at the share of Washingtonians who have public coverage in some way, shape, or form right now, it is about 50% of the state if we're counting Medicaid, Medicare, PEB/SEB, veterans coverage. that's using OIC data. And of course, we all know that roughly 20% of our state budget is going to healthcare right now. So we're already pouring in a lot of public investment. And so the question that we can be asking ourselves is, what are we getting for that investment? And I know that the commission's been working on that. And then to the piece about employers participating that both Andre and Nathan raised, I think we're overdue, particularly in light of the One Big Beautiful Bill Act, for a discussion about the social compact that we have here in the state between employers, individuals, the state. Employers benefit when workers have health care, and we have seen it with all the progress of the Affordable Care Act that with all the good it has done, it has also allowed some employers to not offer coverage to their employees or their independent contractors. We've seen a growth in employers that are allowing someone else to take up the mantle of health coverage. And I think that's a conversation that we need to revisit and discuss in the landscape that we are in about who is benefiting when everybody has health coverage, and who has a responsibility to be a part of payment for that.
Thank you so much, Emily. I see Annie has a hand raised. Annie, please go ahead.
Hi, I'll just make this real quick, but someone on the lower end of the income spectrum due to disabilities and chronic illnesses, I've already had to personally crowdfund twice this year for healthcare issues. I speak to people with disabilities and chronic illnesses on an almost daily basis who are terrified of the cuts that are coming, and honestly, a lot of people are going to die with these incoming cuts. So I feel like it's super important that the commission takes up this opportunity to discuss funding this and as quickly as possible, so that people don't have to be so worried and so scared of potentially losing their health care and possibly even their lives. Thanks.
Thank you, Annie. Oh, yeah, please go ahead.
Thank you very much. So following up specifically on both points Annie and Emily just made. So I just contributed to a GoFundMe account today to someone who is dealing with the after effects of a stroke. But what I wanted to follow up with what Emily was saying was, as a small business owner, I left that out of my intro. Apologies. The premium increases on our small group plans have gone up nearly 20% in each of the last 2 years. And just our share alone for the couple employees that we have, which is a very, very small business, is over $4,000 a month. That doesn't even count their share, what they have to do, as well as if they have a family member on that plan. So if we could keep the funding mechanism from the tax increase from going up 20% a year, I think a lot of small business owners would view that as a win. As sad as that is right now, the more people I talk to and say, oh, I can actually afford to give my employees healthcare benefits, they kind of look at me sideways like, oh, wow, that's incredible. And it shouldn't have to be that way. So that's what I wanted to add. Thank you.
Can I jump in?
Yeah, of course.
I just want to jump in. There's a question in the chat. Rep Schmick, I don't know if you want to unmute and ask this question. And Emily, I realize you're not logged in, so you can't see this. Not everyone's logged in right now. The question is, and this is from Representative Joe Schmick, who's one of our commission members. Emily, can you provide the commission with the data which you base the statement on that employers are not offering health insurance and moving them to government subsidized insurance?
Thank you. Thank you, Representative Schmick, for that question. So I think what we've seen increasingly over the last 10 years is that a couple things. Number one, a diminishment of the small group market, and John spoke to that. I think we've just seen the numbers declining over time, and I appreciate John's point because I also am a small employee. I also run a small business. I have 7 employees, and 10% of our budget goes to healthcare every year. So I see that personally, but in addition to that, we've seen the small group market declining over time as well. In the large group market, I think what we've seen is more movement towards different kinds of employment relationships. So when we had the conversation about the Affordable Care Act 15 years ago now, we didn't have the gig economy. We didn't have independent contractors working for DoorDash and all of the different Uber and all of the different companies that we have today. And I know that there has been a lot of benefit to our economy and our state from those kinds of arrangements. But by and large, those independent contractors or gig workers are not receiving health coverage options. So when we look at, say, for example, the healthcare authorities' data on which employers have the most Medicaid recipients, we can see very clearly in the data that that there is growth in some of those independent contractor type companies, and that comes from a 2024 report from the Healthcare Authority. And I'd be glad to follow up with some more information if it's useful to you, Representative Schmick.
Okay, I see a thumbs up from Representative Schmick. So well done, Emily. Thank you.
And Marcia.
Oh,
make a
sure.
comment.
Please go ahead, Marcia.
So bringing us back to
Marcia, hold on. Can you share that with, so we can share it with everybody? Thank you. Sorry.
Okay. So I wanted to talk about another aspect of the financing. What are you talking about? Oh, can you hear me? Yeah. All right. So cost containment is really important too in the financing. So when you roll out the system, and our suggestions for cost containment would include global budgeting for hospitals and other provider organizations, price caps on services and pharmaceuticals, bulk purchasing with other states as possible, and streamlined administration. That means fewer prior authorization requirements and denied claims. And then, of course, the transitional solutions that Emily brought up about the combining the already publicly financed plans, the PEBSEB, Medicaid, and then seeking the federal waivers to include Medicare. So, and our goal is zero cost sharing at point of service. So just to summarize, we can move on.
Thank you so much. Do you mind if I ask a quick follow-up to that? And I apologize if this is a dumb question. I've been with the commission since January, and I see that the commission's kind of directive is split between the transitional solutions and identifying a pathway for financing a unified, or finding a way to finance unified financing system. And speaking to your point, Marcia, about wanting to prioritize cost containment principles as well, is there any drawbacks to pursuing the cost containment, or I guess I'd bucket it under the transitional solutions approach, in terms of taking away some time or resources from the kind of push towards universal care or implementing a universal system? Or do you see those as complementary, or perhaps as a little bit of a zero-sum situation where investing time and resources in one might not advance either as far?
Well, actually, to answer that question is kind of a jump ahead, because if there was if the trust board was set up and had the legislative authority to set up the system, and they could have a subgroup that is responsible for making sure that happens. So it's a whole unified thing. I mean, it's not which comes first, but the fact is that we could do more cost containment now before the system is set up. But it's really so important to get the system, to get the group that is going to implement the system have the authority to do so, and quicker rather than later. So the priority for us is get the system up, get it up, and then utilize all these other strategies to make sure that it is cost effective. That makes it sustainable.
Thank you so much,
So
Marcia.
that's the thinking on that. Thank you for the question.
So do the the cost containment strategies, then they lend themselves both to our current system as well as they can be implemented and incorporated into a universal system as well. So it's
Exactly.
not as if spending time on those strategies somehow won't be useful towards a later universal system.
No, that's right. Yeah, no,
thank you.
it's all part of the same ball of wax. in my
Okay, let's go with Joan and then we'll come to Andre. Thank you.
Thanks. Yeah. Hi, everyone. Thank you so much for this discussion. My question was also around cost containment. Marcia, you beat me to the punch, and I'm grateful to hear your perspective. Just wanted to give space to see if there were other advocates here who wanted to talk about their perspective on cost containment. I was interested that it showed up in your comments when I was reading these in advance, and I hadn't seen it elsewhere. I saw the mostly discussion of like progressive taxation and assessments and those pieces. So I wasn't sure if anyone had a perspective on the cost containment efforts that are underway and have been continuing in the legislative environment and elsewhere.
So this kind of relates a little bit to the interim versus the long term, and I think cost containment related there. But I think that, you know, where the interim solutions can be in conflict with the long-term solutions are where the interim solutions are some form of subsidization or, you know, effectively adding strength to the existing system, which is the root cause of the problems, right? And so we see costs going up. And there's a slide that I use in some of my presentations that shows that it's increased by 7-fold after adjustment for inflation since 1970. And on that curve, you know, I point out all these moments where we have passed forms of legislation that are attempting to solve this problem, but you barely even see a blip with like the Affordable Care Act, for instance, right? And so I think that when we're talking about interim versus a more visionary long-term solution, it can be tempting to say that it is easier to take these very small steps and to address the most immediate problem. But when they kind of continue to prop up the existing system, and the existing system is the thing that's driving costs up, you don't really make progress. And I think that there's evidence that it really just draws out the total cost, the length of the transition, the amount of suffering that happens during that transition, and it just doesn't have to. And so we look at Taiwan as a modern example of a rapidly developed single-payer system. And in the first year after its implementation, they got their uninsurance rate from 60%, or rather 60% coverage rate to over 92%, and then since then have achieved over 99% coverage. But some of these models show that the transition can happen very quickly and then begin to actually address the issues in a way that drawing the process out really seems to just prolong the problem.
I would add one more thing. You know, in this fragmented multi-payer system we have, it's like playing whack-a-mole. Thank you. In this fragmented multiplayer system we have, it's like playing whack-a-mole. When you get it down to a single payer, it also incentivizes the government a lot more to, you know, implement stronger laws to drive down costs. So it works in favor for that reason, because at that point, everybody's looking at the money being spent because it's their money and it's their healthcare money. So that's another reason why I would say we need to continue to examine like building a pool to make that happen.
Thank you, Andre and Nathan. Joan, did that answer your question, or would you any more feedback?
Yeah.
Okay, thank you so much. Not seeing any other hands and wanting to keep us moving through our agenda here, I will move to the next question. Excellent. Our current healthcare system is extremely complex and often confusing. Many people want to change it, but they may not know where to start. What are some of the best ways you have found to communicate with people about universal healthcare? What are the biggest hurdles? And how do you think the commission can best gather input? So maybe I was lying when I said that was one question. It's multiple questions. And I believe we will hand this over to Nathan. And okay, perfect. With Washington Can. Thank you.
Absolutely. So every year, Washington Can talks to thousands of people across Washington about the broken nature of our healthcare system. And what we found really works is really focusing on people's direct experiences, both in terms of the escalating costs and the prior authorization denials. Those things seem to be what really resonates with people on a day-to-day basis. And we need to frame this discussion broadly as our elected officials or us as a community fighting back against the special interests that are now harming patients and regular people so that we can lower costs and get a plan that will benefit all of us. Some major hurdles that we've seen to this is just, and we see this at all levels, even the federal level, we're dealing with this right now. A major obstacle is the widespread lack of confidence in established institutions. That's a major problem that we're hearing from folks out in the community. By the way, happy primary election day, everybody. So regular people are seeing these escalating costs. They're seeing the decline in access to care. They can't get an appointment for months down the road. And at the same time, they see proposals that have been advanced for going back to 1993 consistently failing to advance. And that leads to a lack of faith that getting involved in our system and is possible. And then therefore the effort that we're going to expend to do something about it gets less likely. So I think that's a major hurdle. And then in terms of the other, I want to make sure I get all the questions. And then in terms of public input, and going back to what was said earlier, thank you for acknowledging some of the awkwardness around the public comments and just the structure of how public meetings work. That's amazing. I think we should just continue to have discussions like this going forward as a way to maintain that connection between the public and advocates and the commission. And I'll turn it over to other friends who might have comments on the communication piece.
Of course. Anyone else? Andre, please go ahead.
I just like to add a little. I think it's very important to meet the public where they are and to address their frustrations with the system. And I brought some polling from Economic Opportunity Institute. But, I think the first thing is that across the political spectrum, 58% of Republicans, and going up from there, reject the market and the private healthcare system. On the question of the healthcare system in Washington needs to change, 78% of Democrats agree with that. 83% of Republicans agree with that. So the calls for change completely across the board. And then on the question, elected leaders and government officials in Washington should take action to reduce healthcare costs. We start at 86% with Republicans and get up to 89% with Democrats. So starting with the rejection of the healthcare system, the call to action on the legislature, and then when you're out there and, whole Washington has gathered hundreds of thousands of signatures and had these conversations, people's frustrations are the fact that it's tied to employment, the fact that their coverage is never as comprehensive as they need it to be, or they can't tell what's covered versus what's not covered. So consistency, security, provider networks, they want greater choice in providers, cost controls, and then cost transparency. The fact that you can be surprised by how much your service costs, right? So I think start with understanding, what they are rejecting, and then have your conversation oriented towards addressing those things directly. They're not as interested in, very wonky discussions like the one we're having today, right? But they do want to have their problems addressed.
Please go ahead, Vicki. Oh.
Well, and this is where I'm very interested in what kind of partnership we could have, because the commission has 2 staff and a bunch of volunteers and a travel freeze. And I don't know how and if that's going to change. So one of the things that, and this is just me, Vicki Lowe, talking, how can we partner together with you guys to help have those conversations in communities and help get that, Because I understand people need to be heard, and I think it's a really important part of the work we do. That's why I think public comment is so important, because, everybody has experiences the world in their own way, and the harms the current system causes. We really need to be thinking about those things, but we don't have the capacity to do that kind of outreach, but you guys do. So what do you think about that?
Can I jump on that?
Yeah, go ahead.
So like Washington Can, I referenced our canvases earlier. Yeah, sometimes I have to remind myself, it's okay for me to like speak from any gut instinct, because me and my fellow canvassers have had more conversations with people about organizing around healthcare reform and changing the healthcare system with like regular people than anybody else in the state and probably the country. And so in regards to that, I'd be happy to have a conversation at some point where a little more directly, where we could examine how, as we're going out there knocking on doors every day and talking on the phone, there could be something of utility for y'all specific. Like, absolutely. I think we could explore that.
Yeah, and please go ahead, Andre, and then we'll return over here.
Sure, thank you. I just wanted to say, I think this needs to be an all hands on deck situation. We have a lot of powerful institutions in Washington, right? And I think that there's been a coordination issue where it is unclear, even 4 years into this commission, is universal healthcare happening in Washington? And is there a vision or a design that has reached some form of consensus? And as a point of comparison, I sometimes use light rail expansion as a counterexample, where we say, like, look, yes, it takes longer than any of us want it to, right? I would have loved to take the light rail here today. So it takes a long time. It costs a lot of money. The deadlines move around. The plans change, right? But there's a fundamental understanding between the state and the public that light rail expansion is happening. They regularly re-up the funding for it, even when it's taken to the ballot. And I think that I'm not even sure if we could get out of this room today, with a clear commitment from the commission that, well, we are fundamentally advocating and designing and strategizing for the completion of a single payer healthcare system, even though it's right there in the bill that created the commission. And even though we've talked about it for 4 years, right? So I think we need to get to a point where this commitment has been made and reiterated and publicized and communicated regularly to the public. I get pamphlets in the mail that put a map with dates on it. And this is what the light rail system is going to look like. This is when this station is going to open. And we're just not there with healthcare yet. And so I think that would be the fundamental difference beyond any of the design questions, right? Beyond any of the specifics would be, this is happening. It's happening on approximately this timeline. This is when you will be able to use certain parts of it. So it's not all going to happen overnight, but maybe in 2 years, you'll at least be able to get your primary care, or something like that, right? There's an infinite number of answers to this question, but we need to start picking some of them.
Thank you, Andre. Just one point of clarification. So obviously the commission doesn't have enforcement authority or the ability to pass legislation. We can certainly make recommendations to the legislature. So given, our capacity as kind of a body that can bring different voices together and has a lot of strength in its membership and making recommendations, what do you think the Universal Commission could do to kind of elevate the issue that you're talking about?
Well, I think that the commission should be working more actively with the legislature. There's legislators on the commission, and that's great. I think there's been some legislation that has gone through the cycle of recommendation and passage, but I think that there needs to be a little bit more of a unity or leadership that comes out of some combination of commission, legislature, and executive, right? It would help a lot to have the executive on board, right? I mean, if Bob Ferguson were to come out at the end of this week and say, this is my priority as governor, right? And everyone could then begin to line up to move that forward. But I think that and there's a reason why the Washington Health Trust is comprehensive legislation, right? Because it creates a 4-year transition, but it is a framework for moving us from where we are today to where we would like to be. And it recognizes that there are challenges along that way. There are portions that require federal cooperation that may need to wait for a more favorable federal administration. But once passed, we could say, okay, we are now moving towards a goal that we all see, right? And it is written down. And I think that whether that happens through legislation, which would maybe be very helpful, even just the more conceptual alignment between all of the parts of the state, right? And when I say the state in this case, I mean the state government. But to begin to say, this is our vision, and to communicate that with the public, to invite in, and this commission is doing part of that, right? But I just think that most people don't know that there's a Universal Healthcare Commission. I'm not going to tell on who, but I did have one conversation with a legislator, and I said, "Are you aware that we have a Universal Healthcare Commission?" They said, "No, I'm not aware of that." And then I went and I looked, and so be it. They had actually voted on the bill that had created the commission. So I don't think that there is an active enough collaboration between the legislature and the commission.
Thank you so much, Andre. I think we have a little queue here, Emily. Apologies. Rep Parsley, please go ahead. And then we have Annie and then Emily.
Mine is pretty quick. It goes to what Chair Lowe was talking about. And then a request at the end of my question. We have to bring the public along. There's no doubt. And from your statistics here, it's nonpartisan. This is nonpartisan. So how can we leverage the advocates and activists to help educating our chambers and our committees that have to get it out of the committee onto the, the Ways and Means or, my particular side? How are we going to get that? Because we're one on one side and one up on the screen, but there's 98 or 96 other people and you have 48. We need to get help. So can we rely on the advocates for that? And what's your thoughts on that? And then the second thing is, can we get this by email?
No, answer on the last one is absolutely. I'll send it in an email. I just made it this morning. And yes, we're always available. We will make ourselves as available as we can. And the last one that I will just say is that we have formally requested a joint committee work session where some of this stuff can be discussed. And we want that during this interim because, as I think has already been brought up, but ACA subsidies are expiring by the end of the year. The legislature is out of session, but I mean, there is an emergency coming. The uninsured population could be doubling starting in 2027. And so that's, there's an urgency to it. But, I think I've never served in the legislature, right? So I don't know all of the means that the legislature has at its disposal. But I think that we need to talk about, we need to be able to have a real conversation with legislators about it. And it can be quite difficult because there's so many. And in my experience, a lot of the times it can be a bit deflective when there is an attempt to actually have some outreach about this. But I think that requires leadership within the legislature to say, actually, this is my priority. I want to figure this out. I want to have my questions answered, and then to mobilize, their caucus and their members, and to make it an organic priority within the legislature. And I don't mean to say, I'm not there, so I'm sure that there's lots on the plate. I know that, but I think that we will certainly need the legislature's help in doing this education and this outreach, because we desperately want to, but it's difficult for us as well.
Yes. Representative Parks, do you have any other?
I'm looking at the long game, saying we need to educate now, because when the bill finally comes, we don't want to be having a floor fight that goes nowhere.
Thank you. And hopefully as a commission as well, we can offer any support or assistance in terms of providing, explanations, background. And I'm going to hand it off to Annie online.
I'll try to make this quick because I don't want to take up too much time, but I just wanted to speak for a moment to the question about communicating with people about universal healthcare. So disability community does a lot of organizing online. It's one of the best tools that we have for reaching a large amount of people. And so I really think that with the help with all of the advocate organizations here today, as well as the Universal Healthcare Commission, we need to be doing more outreach, not only by knocking on doors and things of that nature, but also online. Like a lot of people I talk to don't even have any idea what the Universal Healthcare Commission is or what the purpose of it is. And so I really think that, in collaboration with the advocates, the UHCC could take advantage of online spaces to really have more public forums and more transparency and communication with the public on what's happening and what the plan and what's being worked on, what the transition plan would look like, so on and so forth is really, really important. Thank you.
Thank you so much, Annie. And just going to transition to Emily. Just want to note one of the difficulties in utilizing some of the online forums is Open Public Meetings Act requirements that do provide some limitations in terms of the venue, prior notice, having conversations with a quorum of members and so forth, and needing to take meeting minutes. So not to say that we don't want to investigate and hopefully take advantage of those opportunities, just highlighting, similar to the public comment, that there is a layer of formality with boards and commissions that do make some of these innovative approaches occasionally difficult. And so always looking for ways like this meeting today to find an opportunity to still have those conversations, but stay on the right side of the law. And Emily, or Ronnie first, then Emily. Okay.
I think the answer to Representative Parsley's question is yes. Each of our organizations are committed to supporting that and are working with legislators and with the public. And it doesn't require a final plan before we interact. We have lists of visions and goals that we've already established individually. The commission has done that. We should be asking the open-ended question to the public, what are your visions, and comparing that and moving forward. There is a way to do that.
And I'll just also add towards that point, Ronnie, thank you. A piece of low-hanging fruit perhaps on that is House Bill 1508 from a couple of years ago required the Healthcare Cost Transparency Board to do regular underinsurance surveys and employer surveys. And unfortunately, those surveys have been frozen due to the budget freeze. But those would be valuable opportunities to gather significant public input on our healthcare system and how people are faring in it. And I think would answer the question that Representative Schmick asked as well in a square way, because unfortunately we do not have a state-specific data source on employer health coverage offers and their changes in their benefits, unlike many other states. So I think we're missing an opportunity there that is frankly pretty low cost and easy to do.
Thank you so much, Emily. And we've gone a little bit off the rails in terms of following our agenda and timeline. I know some folks would like to take a quick break, so maybe we do 3 minute, let's say five, sorry. Okay, 5 minute break. And then I think it would be nice, but I would love to hear any feedback. Originally, we had planned to have these questions that came from commission members that our advocates were responding to, and then had questions from advocates that commission members and FTAC members would respond to, and wondering if folks would be open to not addressing the second two questions, and we can circulate, if the advocacy groups are comfortable, their responses in a written format, and then we can spend the remainder of the meeting going through those questions. Yeah, go ahead, Mary.
Just want to add, yeah, real quick, thank you for providing the written answers. We will circulate that. There's also other handouts going about. I know there's one from Whole Washington, one from Healthcare for All Washington. If you can send all those to the general mailbox, we will send everything out as one packet and share all the information with commission members and with FTAC members. So thank you very much.
Thank you. So when we return, we will transition over to the advocacy questions, and let's plan to be back at 4:42. Thank you.
If you need restrooms, walk down that hall. Use the elevators to your right, turn to your left.
All right, folks, if we can start gathering back. All right, folks, if we can get settled again. We are running a little short on time and just want to make sure we're able to get some additional dialogue here. I feel like my voice might actually do a better job.
Yes, people wanted that break.
Thank you. Oh, okay, excellent. Thank you all. Again, apologies for running a little behind here today. I just want to offer one point of clarification. OPMA requirements, we do need to end the meeting at 5. So we are not able to exceed the time to cover all of these, which sets up a little bit of a problem because we have 5 questions here. 3 minutes each. So my instinct is to, in terms of the first question, to maybe send this over to Vicky for a response, and then happy to kind of open it up for any commission or FTAC member reflections, or to speak to any of these questions, but just want to provide a little bit of openness to allow for as much conversation as possible in this limited time. If there's any objections, raise them now.
And so
I do not think we have a copy of those. Do we have a copy of the
No,
advocates'
it's been-
questions?
Passed around if
Okay.
folks have it, but then we can email it out. We'll just read it out before.
Okay,
Here.
and so
Sure.
I will, the question for Vicky from our advocates is, the legislative mandate to the Universal Healthcare Commission includes providing an inventory of the key design elements of a universal healthcare system, including a unified system, including but not limited to a single payer financing system. Are there any reasons the specific requirement has not been met yet? Will the commission tackle this assignment? What is the Universal Commission's deliverable?
So, and maybe there's just a discrepancy in understanding, but we did this in the first report, and that was given to the legislature in 2022. Does that sound right, Dave, Joan? And I know.
Roughly,
And
yeah.
they were COVID years, so those were some rough years. But so and I think if you keep reading in this part of the legislation, it talks about it being due in 2022. And as far as we know, we met that deadline. So maybe there's further discussion about what that is, but I'll leave it there for now.
Thank you, Vicky. I just want to see if there's anyone else that I guess we're looking now for commission member, FTAC member feedback on any of these questions. I'm happy to just move along to the next question.
Pam's hand is up.
Oh, Pam, please go ahead.
Yeah, hi. I just have a brief comment. Having sat through many FTAC meetings and a lot of the commission meetings, the frustration from the advocates is palpable at times, that people feel that they would like things to go much faster. And so I've certainly felt that as a member of FTAC. And I think this could be a very long conversation about how we pace the work. But I think a couple things is we're kind of staffed to get the pace that we have. And I know that people have worked really hard to go to the pace we're going. And I've been on other commissions that move faster, but they were they had far more resources than we have had. So I think that's, I maybe someone can bookmark that for a future discussion, or maybe a side staff discussion of the things we can do. But I just wanted to acknowledge the frustration that the advocates have felt, that it's not that we're unaware, and that, it's something that needs to be talked about and responded to.
Thank you, Pam. And that kind of feeds into the question number 2 also, and the commissioners also, it's hard for us because we want universal health care just as much as everybody else. But also, we got these guys and we're all kind of volunteers. And so I think as far as the next question, which is about timeline, it says commission members, along with many in the public, have expressed frustration at the slow pace of progress, which is even more urgent now with the new federal cuts to Medicaid and the ACA. And again, so lack of resources. And so how can we work together to get more resources? I think we talked a little bit about that with better education to legislators and really those conversations with the public too, because public funding is going to come from the public. So they're going to have to understand, that because they're not going to lose something in order to gain this, right? I don't know if any commissioners have any other comments, or the legislators who are also mostly commissioners. Almost.
Andre, I see. Do you have a question?
Oh, other than question 3?
Well, no, we can move to question. I just saw your hand going to the microphone. I didn't know if you had a follow-up question there. Okay, sorry. And I don't mean to interrupt you at all, Vicky. I'll move to question 3. Will the commission make a request to legislative committees to hold a joint work session this fall or a public hearing during the 2026 session on universal healthcare legislation?
Do the legislators want to take that question? I think we've heard from all of us about it.
I'm going to pitch this to the chair of the Senate Healthcare Committee, because I actually just asked about that for the House. And when was the last time that both committees actually held a joint?
Thank you, Representative Partially. In the past, the Senate has held hearing on the bill. I don't have that year in front of me at this time, but I would want to understand and have a conversation, obviously, with the chair of the House Healthcare Committee as well, what the purpose would be, make sure that we are all in agreement as to, what the end result is that we want from holding a work session and a discussion, and how it will better help inform the work of this commission and the work of the legislature as we continue to move forward. So happy to have that discussion and just ensure that we are all really clear about, what it is we want to accomplish together through a work session.
Yeah.
Yeah, go ahead, please.
Thank you. And I don't have the year either. Perhaps Ronnie or Marcia would, but I can say that it would have been before 2018. And I can say that in my own conversations with Chair Bernowski, I had a sort of, at least a verbal agreement that he was open to it. And, I think in the conversation earlier about how can we have this conversation with legislators to create a platform for discussion and education and hearing the concerns and then addressing those concerns. If there's a better way of doing that, please let me know. But this is our pitch for how that can be done. Thank you.
Thank you all. Annie, please go ahead.
I just want to kind of add that I think it would go a long way in showing the public that the commission as well as legislators really care about addressing these upcoming cuts. If there is a special session to address these issues, because a lot of us are really, really scared of these upcoming cuts. And I think it's really important that we do what we can to really try to push for a special session. Thank you.
Thank you, Annie, for those comments. And sorry for the image on the screen here. It's mortifying to look up and just see yourself. So we have 8 minutes left. Nathan, I see you are identified with question 4. Would you like to introduce that question for folks? or John, whoever.
So far, the labor movement in Washington has not been engaged with the work of the commission, not deeply engaged anyway. Now that there's growing interest after last month's Washington State Labor Council convention adopting a single payer resolution, which I will note, like there was like 300 something votes and there was only one vote against. So that to give you an idea. So there is that increased engagement with the labor campaign for single payer. And anyway, yeah, just when will the commission take some steps to invite and engage with labor?
I guess I'm answering that.
Yeah, please go.
It's good to hear this. And so I think we'll work with staff to think about how to, because that's one of the things that we talk about a lot is like self-funded plans and ERISA and who the state really has any say over bringing into it. But if we can bring people in because they want to be part of the universal health plan, then that's a great way to do it. So thank you for sharing that. Don't know if any of my fellow commissioners have comments.
I guess I just want to underscore what I think that this is a really important piece of the puzzle, because if you look at the history of labor, one of the bread and butter issues is benefits. It's safe work conditions and benefits. And if there's going to be something that changes the way labor in the future has to reinvent itself, because there will always be things for labor to advocate for. But if one of the core issues is suddenly solved, I think we can all celebrate and go, now where do all that ever go? And I don't, I think that my experience has been that there is some trepidation about wondering what that future world looks like for labor, where one of their bread and butter issues is solved. So I think it is really important to engage so there's not that vacuum all of a sudden.
Thank you so much.
Yes.
Yeah, please go ahead.
Thank you. Yes. Along with that, I would suggest that inviting a speaker from the labor campaign for single payer to speak to the commission would be a good first step. There is someone in Minnesota, her name is Rose Roach, and some of us have heard from her before. And I see you're nodding your head, Mary. Yeah, and she's an effective speaker. She's got a lot of experience. She's a nurse, a former nurse also. And so she's been in the healthcare for all arena for many years as a nurse, part of her job being the executive director of the Minnesota Nurses Association. So that'd be wonderful. Thank you.
Thank you, Marcia. And I am very happy to that we made it to our last question here. John, would you like to introduce that for us?
Absolutely. So this is again getting the public more involved. So we're going to continue to bring members, Washington can at least. We're going to continue to bring patients into this space and give public comment. And of course, a lot of our constituent organizations have email lists where we can blast out information to our people. So beyond those kind of ways that we've been doing it so far, are there any other ways that the commission would like to get public input in ways that we aren't thinking about it right now? And then also as a corollary to that, another question that we wanted to get out was beyond public comment and other ways that we've been working on things, how can we get information about what's going on in other states to the commission in the most effective way possible? Snuck a couple in there for you.
And John, I'm probably not the person you want to hear from, but I do think in terms of some of the resources that we have moved to a monthly Gov delivery with announcements, and Gov delivery obviously comes with some of its own issues, but we do have quite a few subscribers, and I'd like to move towards including kind of a roundup monthly of different activities related to, in this case, universal healthcare, or different activities that our advocacy organizations have going on, or new papers, research, and at the very least, just using our body and our visibility to at least highlight some of these events. So just seeing that as one opportunity to hopefully do a better job of communicating about all the good work being done around universal healthcare.
I just wanted to jump back to, I think it was question 1. And I wanted to make sure we got through the questions before I brought this up. But would the chair be willing to characterize the baseline report as having recommended an implementation for single payer and a strategy for getting there? Is that your kind of framing of what's in the report?
I think in the report, and it's been a while since I've read it, but we laid out what were the elements that were needed for a universal health, a unified payment system too, I think. And then we did our work plan based on those elements. And also that our work plan is very closely related to the report that came out from the Universal Health Care Work Group. And, those two things have guided our work. But the report was intended to meet that requirement in the bill. It was like we put a lot of work into that instead of like actually focusing on the things we wanted to focus on.
Thank you.
Yes. And then to question 5, just really quickly, I mentioned this earlier about how we can work together to, really reach out into communities and hear those voices. And also to Representative Parsley's request, how can you help those people speak to legislators so they can really understand and hear the actual pain of people trying to use our broken healthcare system? Okay.
I just want to, thank you. I want to note that there's a question in the chat from Representative Schmick before we close out. Earlier in the meeting, there were statistics given about support for universal health care. Can the questions asked be submitted to the commission? Was it yours? Okay. Was it yours, Andre? Okay. Yes. I think that'll be in the information that comes out. Thank you.
And I am going to give it back to Vicky to close us out. I just want to acknowledge the Hux group that we've been meeting with several months in advance of this to coordinate this meeting. Again, very appreciative for folks' trust in trying this new opportunity. Clearly, we didn't get the time right, but there are lots of, I think, good that came out of this. And next iteration, we can add some more time. So thank you, everyone, for your patience and participation, and I will send it to Vicky.
Thank you, Ross, and thank you for helping facilitate. We did an exercise that my boss generally calls trying to put 10 pounds of potatoes in a 5-pound bag. So I think actually we got a lot of work accomplished today. I really appreciate each and every one of you for coming here. I feel bad for having my back to the rest of you, but we appreciate you guys too back here. This is really important work we're doing, and it's really important that we have, the voices of the people who are impacted. Your questions today and then your answers to us have been really helpful. And we just really appreciate how much you guys care and you keep coming back and talking to us. We may not always agree, but I think our end goal is the same. And that is really important to remember that, we are working for a unified system. So thank you. And I think we'll, work with Ross and Mary and Allie to see, what we can do to coordinate better. This meeting is being recorded. It'll be on the commission website, on the HCA's website, and then invite you all to join us for our next Universal Healthcare Commission meeting on September 11th here from 2 to 5. So with that, I'd like to adjourn the meeting. Thank you all for your time today.
Thank you.